Okay, guys, so I decided to jump on here, record this Zoom so that you can do it anytime this evening. So I'm going to go over the test like I normally do, and you can stop and rewind and review the question or the phrase that I'm mentioning so that you can study all day long. Okay, here we go. All right. So remember, this is over urinary. I think it's three chapters or four. Don't quote me on that. 57, 58, and 60. Oh, you know. If you know, you know. Obviously, I don't. Okay. So, you need to know if a client is scheduled for a renal angiography. What would be appropriate items that you would need to document about a patient undergoing a renal angiography. Okay. If you're talking to a patient in the diabetic clinic who's struggling with compliance and you're talking about disease progression, what manifestations of diabetes in the urinary system is going to be most notable? Think about what we've been talking about. Okay. Understand what a creatinine clearance is, why it would be accurate, and how do you need, if somebody who is getting a creatinine clearance test is asking you, why am I getting this test? What would you tell them? If you are explaining the renal system to one of your patients, remember I told you to know the flow of urine. So you would tell them that the what empties into the ureters? Where does the urine flow? How does it empty into the ureters? If you're taking care of a patient in a long-term care facility, and remember it's in the summer, think about the physiological changes that our patients undergo when they're aging. Long-term care facility, renal system, and aging. What do we need to take into account with those patients and what could result? Okay, sorry about that. Okay, so if you're assisting the doctor in completing a cystoscopy, remember we've talked about cystoscopies. What position are you going to place that patient in before and even after they've had the procedure? What position do you put someone in when they're having a cystoscopy? When we're looking at patients with nocturia, what do we need to evaluate? What kind of history and assessment are we going to do on a patient that is having complaints of nocturia? What kind of diagnostic tests would we expect as nurses to have a patient undergo if we're looking at arterial supply to the kidneys? If we have a patient that is suspected of having a UTI and we're doing a 24-hour urine collection, what are some important things that we need to know about a 24-hour urine collection? And you need to be able to tell me in regards to a couple of scenarios in here, I do believe. Let's see. If you're talking to a client about functions of the kidney, there are going to be certain things that you're going to tell me that the kidney does. And so you need to know all the things the kidney does, right? What are the 3 things the kidneys do? And then what's the extra little thing that the kidneys do? If you and I are taking care of a patient that's brought into the ER after being found unconscious out in the hot summer heat, and we think they're dehydrated, our baseline lab work, including a urine specific gravity, is ordered. What relation between the client's symptoms and the urine specific gravity is anticipated? So if we're taking care of someone that we think is dehydrated, what is their urine specific gravity going to look like? What correlation are we expecting? If we're looking at a patient with chronic glomerular nephritis, we note that the client has generalized edema. The nurse documents this as which of the following. Remember, we talked about acute versus chronic glomerular nephritis. Chronic glomerular nephritis, patients have a certain type of edema. What do we call that edema? If you're taking care of a patient with polycystic kidney disease, what are some things that you would need to assess? Polycystic kidney disease. What do we really need to be looking at if their kidneys aren't functioning well, right? If you're taking care of a patient, they come into your clinic and they're talking about a sudden onset of sharp, severe flank pain. And they say some, they're giving you information as you're assessing them. Where's your brain going to start going with this sudden, intense flank pain? If you're helping a patient get ready for dialysis, what are some important things that you need to do? We talked about patients with hemodialysis, hemodialysis versus peritoneal dialysis. How is that patient on hemodialysis actually getting hooked up to the machine? And so we need to really make sure of certain things before we hook that patient up to the machine. If you have a patient with several calculi in the ureter and they are scheduled for an extracorporeal shockwave lithotripsy, I'm going to put some teaching statements by the nurse, you. So which one of the teaching statements best describes the lithotripsy that you're telling your patient about? Okay. You have a patient that's had a nephrectomy. Which assessment finding is most important in determining nursing care for the client? Okay, so you need to think through airway, breathing, circulation, what's happening to the patient, what is going to be the most important thing that you're looking at. Okay, remember, you need to know what their urinary output should be. What's the basic that they have to meet every hour, the lowest that they can do every hour. If I'm asked to speak at a women's group about preventing cystitis, you need to be able to tell me and pick out one of several. Okay, let me stop. I'm going to give you several answers. All right. Which of the following would the nurse include in the presentation? There's 4 choices. One of them are the management tools and techniques to prevent cystitis. Okay. If we are examining a patient's bladder stones and we look at them and the lab says they're mostly made out of uric acid, what kind of diet do we not want them to have? Remember my keywords. What kind of diet do we want them to have? If I have a patient that I'm suspecting has a malignant tumor in the bladder, what's the one symptom that is going to key me in that it could be malignant? This is 9 times out of 10 your determining factor. If I have an ileal conduit created for the patient after a radical cystectomy, which the following would the nurse expect to include in the client's plan of care? Plan of care. We're not going to be there all the time to help them manage that appliance. Remember, one of the things that they really need to do is be able to manage their appliances. If you're coming out of the morning report and you have to use a bladder scanner on your patient following urination and the client voids 300, they're denying any pain upon urination, and you scan them and they have 250 cc's of urine still in the bladder, how would you document that? Your patient who's on hemodialysis, if they're going every week to get injections of Epigen, what's an important thing that you need to consider as a nurse before you give this injection? What do you need to know about their weekly schedule for hemodialysis? If you're working in a urology office, which classification of medication is anticipated for clients having difficulty in urinary incontinence? So what kind of medication classes do we see and read about patients with incontinence being prescribed? You need to know what the functional unit of the kidney is. I think I've said that 10 times. If you're caring for several patients in the urinary medical unit, which client is at an increased risk for bladder stones? Remember, in your book, we didn't go into it in depth, but you should read about it. There is a certain type of patient who lives a certain type of lifestyle who is at a higher risk for urinary stones. Someone who's up and moving around a lot, walking every day, up and down, exercising, is not at risk for urinary stones. So you need to really look at the patients that I'm giving you and look at their lifestyle so that you can tell me who would be more at risk. Okay. If we're talking over a treatment plan to discuss UTIs, again, why would we change treatment for someone who has had a UTI? If they've been on an antibiotic and we're giving them this antibiotic, I'm going to tell you some symptoms. Why would we need to discontinue that? What's going on? So I need you to critically think through this question. It's not a trick question. It's really quite simple. If you have a patient that has chronic bladder infections and inflammation, the doctors ruled out several diagnoses as now considering interstitial cystitis. You would be most correct to anticipate what kind of diagnostic test. Remember, we can do several tests. We can see what we're looking at, but what's the definitive gold standard for diagnosing interstitial cystitis? If you're taking care of a patient with cystitis, which adjunct therapy would the nurse help to decrease bladder discomfort? And no, it's not cranberry juice. If you're completing a plan of care for a patient with chronic urinary incontinence, which of the following outcomes is going to be your priority? Think about the disease process we're talking about, the symptoms. What is the biggest thing that you're thinking of with someone who has chronic bladder incontinence? Okay. You need to be able to define urinary urgency. Okay. You need to be able to ascertain when someone that you're delegating care to, like an unlicensed assisted personnel, UAP, or a CNA, is not correctly managing the patient that has a Foley catheter. There's certain ways that you need to manage someone with a Foley catheter. right? If I'm transporting someone to X-ray or I'm taking them to the dining room and they have a Foley catheter, I need to be able to manage that Foley catheter effectively, because certain things we do can increase infections, pain, inflammation. So you're managing your team. So if you see someone on your team that you're managing doing something incorrectly, you're going to have to stop them. So I'm going to give you a scenario and you need to be able to identify what that person might be doing incorrectly. Have I got you thoroughly confused? Because I am. Okay. So you're taking care of a patient and they're complaining of UTI signs and symptoms, and we get a urine culture order, a UA, and a CNS. Why do we get a CNS? We've talked about this frequently, so you need to be able to tell me why we're getting a urine culture and sensitivity. Okay. If we're taking care of a patient with a that's had a cystoscopy, and the tube draining urine from the bladder, right? Caring for a client with a cystoscopy tube draining urine from the bladder. When reviewing the client's history prior to administering care, which is of the most concern? We talked about a high risk for these patients with cystoscopy. What are they at high risk for, right? When we're talking about patients with kidney transplants, for donated kidneys, if a patient asks you why can't they just avoid taking immunosuppressive drugs, I need you to be able to critically think and give a pertinent answer so that the patient can understand why you're saying what you're saying. Okay. So kidney transplant, why someone would have to be on an immunosuppressant medication lifelong. You'd have to tell me, give me the best statement to explain that to the patient when they ask that question. If you are reinforcing teaching to a patient who has had acute pyelonephritis, which of the following instructions should the nurse include in the teaching? This is not a trick question. You're going to know this when you see it. A patient with stage 5 chronic kidney disease is experiencing extreme pruritus, has had several areas of crystallized white deposit on the skin. As the nurse, you know this is due to excessive amounts of what substance found in the blood? Make me proud. A client is prescribed amitriptyline, which is an antidepressant for incontinence. The nurse understands which of the following reasons that this drug is an effective treatment. Your favorite, select all that apply. Okay, so why would we be using amitriptyline for incontinence? Okay. Oh, what number was that? 39. My pages are out of order. Here we go. Okay. If you have a patient who's diabetic, who's on metformin, and now is on a diuretic, you should question the administration of which drug after noting an elevation of blood glucose levels. Okay, select all that apply. So you need to understand metformin and its risks. If you have a 13-year-old patient who has urethritis, which of the following assessment answers would indicate further instruction needed, right? So this is where we need to go back to those teaching points. Correct cleaning, what types of underwear are we using? Are we using lots of bubble baths? Is that the healthiest thing to do? And we need to urinate after sexual intercourse. Hopefully she's not having sex at 13. Thank you for coming to my TED Talk. So recall those care instructions. If If you have an older adult male client and he is in a bladder retraining program as part of his treatment for urinary incontinence, you're going to advise him to wear barrier garments such as liners, protectives. But what suggestion would be most appropriate to help him maintain skin integrity? You need to critically think. He's incontinent. He's wearing pads and briefs. What do we need to do to that skin, though? What is most beneficial for that skin? A client with newly diagnosed renal cancer is questioning why detection was delayed, which is the best response. Remember, we've talked about renal cancers. Is there a whole lot of signs and symptoms early, even moderately through the disease process? Okay. If you have a patient that has chronic renal failure, becomes confused, complains of abdominal cramping, racing heart, numbness to the extremities, you're going to relate these symptoms to which of the following lab values? Abdominal cramping, numbness of the extremities, racing heart. What electrolyte is going crazy here? Okay. That one is similar to one question I gave you already. So think about jobs that are going to increase issues with renal calculi. Okay. You need to be able to tell me what Creed's maneuver is and when you would use it. I'm going to give you a list of 4 structures. You need to be able to identify if they belong to the upper or lower urinary tract. So know your parts to where your parts are. If you are looking at morning lab work from one of your patients with chronic renal failure, which finding indicates renal disease? So you need to know your protein levels, specific gravity, right? pH, protein levels. That one is good. Be able to explain the costovertebral angle and what that would be telling us. Okay. If you're assessing a patient and you're doing a assessment of percussion to the costovertebral angle, what is a positive? What is that telling us? Okay. All right, guys. So that's the whole, I went through the whole test. I did it this way just because it's easier for me to go through it and read it. And that way there's not a lot of over talking and noise, and everybody can hear the question clearly, and you can kind of rewind me and go back and forth and listen to it. All right. I hope you guys are having a wonderful weekend. I hope you have a good clinical day tomorrow, and I'll see you Tuesday morning, Group A. Everybody else, I'll see you Tuesday afternoon. Bye.